Okay, so this is Melissa Davis, part 2 of my physical assessment test where I describe the procedures that I was not to demonstrate on the patient. So, when checking their breasts and axilla, you want to have the patient seated with arms hanging loosely to the side. You want to check for dimpling. Inspect both of their breasts for symmetry, size, contour, the skin color, and the texture. Make sure and inspect the nipples and compare them for shape, symmetry, color, smoothness, size, nipple inversion, eversion, and retraction. If the patient is breastfeeding, you also want to check to make sure that they don't have signs of mastitis and make sure and educate them on how to prevent mastitis because it can be very bad. Then you want to have the patient lay down and re-inspect the breast, having arms extended over their head, hands pressed on the hips, pushed together in front of their chest, seated, leaning over in recumbent position. You want to palpate and make sure there's no lumps or nodules. If the breasts are large, perform bimanual palpation. Palpate the nipples, compress them gently to see if there's any discharge. If the patient has discharge, it could be for various reasons, which some are not good reasons. You want to palpate the lymph nodes in the apex, medial, and lateral aspects, anterior and posterior walls of the axilla, and the supraclavicle area to make sure there's no enlargements in the nodules in your lymph nodes. Palpate with the patient sitting and supine with one arm behind the head or a towel under their shoulder. And teach the patient to do self-breast examinations during the week of their period. If the patient has normally lumpy breasts already, then sometimes it's hard to detect extra lumps in there. The female genitalia, you want to have the patient in the lithotomy position, inspect the pubic hair characteristics and distribution, palpate the labia for symmetry of color, make sure there's no discharge, inflammation, irritation, excoriation, or swelling. Sometimes people can have yeast infections, so check for that. Inspect the urethral meatus and the vaginal opening for discharge, lesions, polyps, or fistulas. Milk the Skene glands, palpate the Barthonian glands, inspect the palpate the perineum for smoothness, tenderness, inflammation, fistulas, lesions, or growths. Make sure and look and see if there is any hemorrhoids, external hemorrhoids, and have the patient bear down and check for bulging or urinary incontinence. Inspect the perianal area in the anus for skin characteristics, lesions, fissures, inflammation. Ask them if they've had any problems, any blood when they've been wiping. Internal genitalia speculation examination. Inspect the cervix for the color, position, size, surface characteristics, discharge, size, and shape. Collect necessary specimens for culture and pap smears. Inspect vaginal walls for color, surface, characteristic, and secretions. And then bimanual examination, palpate the vaginal walls for smoothness, tenderness, lesions such as cysts, nodules, or masses. Palpate the cervix for size, shape, length, position, and mobility. Palpate the uterus for location, position and size, contour, mobility, and tenderness. Palpate the ovaries for size, shape, and consistency and tenderness. Palpate the adnexal areas for masses and tenderness. The rectovaginal examination. Assess the sphincter tone. Palpate the rectovaginal septum for thickness, tone, and nodules. Palpate the posterior aspect of the uterus, anterior, posterior rectal walls for masses, polyps, or nodules, strictures, or other irregularities. Tenderness, you want to check their stool for a guaiac to make sure there's no positive blood in their stool. For male genitalia, you want to expect again, inspect the pubic hair for the distribution of the hair. Recheck the foreskin if the patient's not circumcised. If they are circumcised, you obviously don't have to worry about that part. Inspect the glands of the penis for color. The external meatus of the urethra for discharge. Palpate the penis for tenderness or induration. Inspect the scrotum and the ventral surface of the penis for color, texture, asymmetry, unusual thickening, presence of a hernia, transilluminate any masses in the scrotum. Palpate the inguinal canal for direct or indirect hernia. Ask the males if they've ever had a hernia surgery. Palpate the testes, the epididymitis, and the vas deferens for consistency, size, tenderness, bleeding, lumpiness, or nodules. The anus and rectum and prostate exam, you want to inspect the sacrococcygeal and perianal area for skin characteristics lesions, dimpling, tuft of hair, inflammation, or excoriation. Inspect the anus again, the same as on females. You want to make sure there's no prolapse or any fistulas or polyps, hemorrhoids. Palpate the lateral and posterior and anterior rectal walls for nodules, masses, polyps, the same as in females. In males, you want to palpate the posterior surface of the prostate and check to see if they have an enlarged prostate. You want to ask them about if it's an older male. You want to ask them if they have any problems with their stream when they urinate. So you also want to check them for blood in their stool by doing a guaiac sample. And as well as females, you want to have the male patient bear down and palpate deeper for tenderness or nodules. This is my part 2 of my assessment. I hope you have enjoyed it as much as I've enjoyed doing it for you. Not really. Kind of nervous, but it's okay. So have a great day. Enjoy your holidays. Bye.